Hello again, welcome to my Ed Talk. We're going to talk about short and long-acting beta-2 agonists. So, what is the mechanism of action for beta-2 agonists? Well, they're going to activate the bronchial beta-2 receptors. Do you remember what G protein coupled receptor they're linked with? You got it, G-alpha S. The beta-2 agonist medications are going to work on G-alpha S linked bronchial beta-2 receptors to open up those bronchus. What are the two indications for beta-2 agonists? Well, we use them for asthma and bronchospasms. What are the side effects? There's two that we usually see. We'll see tachycardia. This is most common, and this is due to the receptor crossover phenomenon. And if the patient's awake enough to tell you, which hopefully they're not, you'll see palpitations. Short-acting beta-2 agonists, we have albuterol, levalbuterol, and terbutaline. What about our long-acting? Well, for long-acting beta-2 agonists, we'll have formoterol and salmeterol. So if your patient's sleeping, how can they actually get this medication? Well, if your facility is fancy, you have these fancy T-pieces where you can directly insert the medication to be delivered. Sometimes you can do a nebulized treatment where you put the agent inside its chamber, attach it to a T-piece, and then link it into your circuit. Here's an example of what that looks like. But you can do the good old 60 milliliter syringe anesthesia hack, where you take the agent, you put it into a cc syringe, attach it to the end tidal CO2 sampling port, and deliver it to the patient. Here's examples of how that looks like. How do we do this cool hack? Well, you're going to find a 60 milliliter syringe. You're going to remove the plunger and place the cartridge into the 60cc syringe. Finally, you're going to replace this plunger into the syringe and shake that thing up 5 to 10 times. We want that agent really well mixed. Then we're going to screw the syringe into the end tidal CO2 port. Then you're going to give 10 puffs and 10 positive pressure ventilation breaths. We want to give 10 of these breaths because you want that agent to go deep into that lung to take its effect. How do you know this agent's working? Aside from listening to their lungs and hearing improved breath sounds, you can see tachycardia on the monitor. Tachycardia is one of the first side effects that you'll see because of that receptor crossover. But keep in mind that patients that are on beta blockers will not see a huge significant increase in their heart rate. And if you haven't noticed an increase in the heart rate after 3 to 5 minutes, you might want to consider giving more of the medication. Thanks for listening.